and good to have you with us on the 9 p.m. edition of the Urban Debate. Viewers, we've been constantly tracking the data that's released by various state governments and the central government as far as coronavirus is concerned. And then we've constantly been bringing you that analysis. Sometimes we also bring you the projections basis various factors. Today we have an interesting analysis lined up for you. And we are going to be looking at the recovery rate and the active cases rate, and how that curve really moves for various cities, how it has moved in the past 2 months, right up to the point of last week. The idea, viewers, is to see which city is getting what policy right, what could have been the possible reasons when there have been a spike in cases, what policies have worked in controlling the cases. The idea is to watch out for the lessons that these charts and graphs and numbers are telling us. Only that can help us as we move forward, because coronavirus, like I keep saying, isn't going away. We have to learn to live with it. And as we open up, the cases are bound to go up, but by now we should have at least some idea about how to bring it under control. So the first half we spoke about the states and various regions and different regions of our country. Now let's talk about the big cities, because the fact of the matter is these are the big cities that actually carry the big chunk of the load of cases for coronavirus. The rest of the country doesn't have as many cases. These are the ones that bring in the majority of our cases for the entire country. And in that list, Ahmadabad is one of those cities that had become a massive concern by around mid-May. The cases were going up very quickly and it had actually reached the top of the charts. But Ahmedabad has managed to curb that, contain that to some extent, and it is now seeing a rapid rise in recovery rate rather than the active cases rate. What we also found basis these charts that we built was that Delhi is seeing a rapid rise in daily cases, and this turnaround has actually happened by around end of May, and especially in the month of June. And you can see that in the last few days how the Delhi government, the Lieutenant Governor, the centre, everybody is talking about the rising cases and the spike in Delhi. We are going to see that chart and see what really changed. Mumbai, the recovery rate and active cases rate gap is really now narrowing. So we may be heading towards a better time. Only time will tell, though, if we manage to keep it contained. Bengaluru, a gradual fall in active cases and recoveries have been rising steadily, and Bengaluru, any which ways, has far lesser number of cases in comparison to any of our other metros. Chennai, the fall in recoveries and rise in active cases has been a concern. And what happens in Chennai is, we spoke about it a little earlier as well, is that every time they get situation under control, there is some incident or some change in policy, or just the fact that we are letting our guard down, that leads to the spike one more time. Kolkata, the recovery rate and active rate are flat, but with Kolkata it is difficult to judge. There's a lot of controversy around the data. Jaipur is actually one of those cities that has managed to contain it very well. A steady fall has been recorded in active cases as far as Jaipur is concerned. And Pune may also be inching towards some good news, signs of improvement with active cases beginning to fall now. So in Maharashtra, the cities are showing some amount of improvement. Let's say good evening to the panelists who are joining us right now. Dr. Subramanian Swaminathan, Senior Consultant for Infectious Diseases at Gleneagles Global, Chennai. Mr. Javed Ansari, Senior Journalist, joins us this evening. Dr. Giridhar Babu, Professor and Head of Life Course Epidemiology at the Indian Institute of Public Health, is with us from Bengaluru this evening. Santosh Andale, Senior Journalist, joins us from Mumbai. And Dr. Anand Bhan, Researcher for Global Health, Bioethics and Health Policy. But first up, I want to go across to Vinay. Vinay and I have been, going through this data in much detail. And of course, we've been tracking these cities for a while now, Vinay. Let's begin with Delhi, because Delhi is actually a case where the charts show that there was some amount of improvement and, taking place in the month of May. But as it is now very clear, even from government's reaction, the last few days have been a bit of a concern.
Yes, and I think the big worry till about 3 weeks ago was possibly Mumbai, and I think that worry now seems to be shifting a little more towards Delhi. In fact, I mean, even though our data projections are not suggesting what the government seems to be suggesting, and the government has painted a much more alarming picture. The Deputy Chief Minister went on record to say that they are expecting the cases to be 500,000. And that's as alarmist a picture as you can imagine. And I think that kind of alarmist projection is getting backed by how even the central government is reacting to it. Because if you remember, the Lieutenant Governor just yesterday issued an order where they now want to take over India's top sporting infrastructure that exists in Delhi to be converted into COVID hospitals. So obviously, Delhi is looking at a bigger problem. Delhi is also a state that is, landlocked from with three different states around them. And we've been pointing out this problem to you, to our viewers, Tanvi, that the inconsistency of the policy, even though it's a contiguous, I mean, NCR is a contiguous zone, and viruses don't respect geographical boundaries. You can, viruses will not look at the policy in Noida as any different from what it is happening in Delhi. So that could have contributed some bit to it as well. Delhi is also a large pass-through state, and that could have contributed as well, because a large number of movement of people from other states to, say, the other states like Uttar Pradesh or Bihar was happening via Delhi. And all of those factors could have been a big factor. Also remember, Delhi and Bombay are the two biggest ports of entry. So there are issues that can be about contact tracing and all. The big worry, Tanvi, that I see for Delhi is that the government has pretty much now admitted that it is impossible to do any kind of contact tracing anymore. And now they've gotten into this spat over the jargon that one should use, which is about whether there's a community spread or not. For me, the fundamental questions is that let's assume that there is a community spread now, because it's impossible to trace 500,000 cases. But for that, we need to have a policy which is much more robust in terms of testing. It has to be more robust in terms of isolation and containment zones. And we need to be more careful about what we open up. I mean, in terms of the public places, while you open up for economic purposes, the non-economic public activity possibly needs to be reined in for a little bit more than what we seem to have done as of now, Tanvi.
Yes, in fact, let me also bring in Mr. Javed Ansari for some more insights into what's happening in Delhi. Mr. Ansari, the charts also, show a very interesting story where we are now only seeing, a sudden increase which is happening around 25th to 27th May. It looks like things were coming under control. The recovery rate was actually improving and going to be surpass the active cases rate. But that's not happened. It's suddenly just turned. Something's changed in the last 10 days. What's your own sense of how this is being handled in Delhi?
Well, it's been handled very badly, and it's been handled very badly by the center and very badly by the state government. They seem to be at odds despite their public posturing. There's utter confusion at the top. And look, the opening up was out of economic compulsions. And because we've opened up, we are now suddenly, after 2.5 months, everybody's out on the streets, and this kind of community spread is happening. The government is fighting shy because perhaps they don't want to admit, and they don't want to trigger off a kind of panic amongst the people. But the fact is that all of us who are living in Delhi are now on tenterhooks. There are not enough beds. Delhi is hardly testing 2,000 to 2,200 people every day. I mean, which is pathetic with such a huge population. 2,000 is not even a drop in the ocean. We need to be testing so much more. The Chief Minister went on record to assure us time and again that he's made arrangements, that Delhi has made arrangements for 4 times more than the number of patients that it would have. What we realize now, the rude awakening, is that actually we haven't even catered for half of that. There are not enough beds, there's not enough testing, and the citizens of Delhi, I'm sorry for sounding alarmist, but this is, I do believe that I'm echoing popular sentiment in Delhi, that the citizens of Delhi have been left to the mercy of the gods.
Okay, that seems to be a sentiment that has been echoed by many in the last few days. I actually just want to also read out a bit of a data to our viewers to drive home the point that sometimes what happens is that the numbers go up and down because of your testing policy, because of the way the numbers are getting reported, and some of these differences that we see in our charts also comes through. For example, in Delhi, 5th June, 6th June, 7th June, on a daily basis, in this month itself, they were reporting above 850 cases, 855 cases, then 918 cases, and 896 cases. Suddenly on 8th of June, the cases dropped to 587. Now, this was the day that the Delhi government actually tweaked their testing policy and asked the labs to not test asymptomatic people, which was then later on, a day later, overturned by the Lieutenant Governor. And then if you see on 9th of June, again the cases went up to 831. Vinay, before we move to the other cities, quick comment from you even on this. There are a lot of what we see, and we need to emphasize on this to our viewers. We are only putting out the data that the governments give us, and a lot of this data can actually depend on when they reveal the data to us. For example, yesterday the Delhi government didn't report it till late night. It only came this morning. How much of testing they're doing, the drop, the ups and downs in that as well. It's basically the numbers that are being declared by the government.
Yes, and I think the Delhi government has been a little confused in the last 3 weeks or so, whether they want to play a boxing match with the central government or they want to be a doubles partner like a tennis game and act very cooperative. They started off by attacking the central government. The Aam Aadmi Party spokespersons adopted a very vitriolic and hostile tone in the way they were reacting to various measures, and then they suddenly became conciliatory. This isn't the time to do politics, and the government actually went public to create some kind of a public referendum kind of a mood in Delhi, where they started asking questions and people to respond on whether we should open up or not, and then started giving solutions accordingly. They even went to the extent of saying that if Delhi has faced such a huge crisis of loads, should people from outside Delhi be prevented from getting a bed in Delhi, which obviously again got overturned the next day by the Lieutenant Governor, purely because it was constitutionally and legally untenable. Now, that kind of confusion was possibly avoidable. This is not the time to do all of this. As Javed was rightly saying, you needed a consistency in the policy. Delhi is a large state. We all know it's a landlocked state surrounded by different states. And you know that this kind of problem can happen. The anticipation of the problem was the key, which is much the same we saw in Mumbai, Tanvi, for instance, where the governments did not anticipate it and prepare and use the strict lockdown phase of the first 45 days to build that infrastructure. Delhi should have done that. They should have done that earlier, instead of now scrambling around to look for stadiums and hotels, as they're now talking about, to be converted into hospitals. Because there are more than one stories that are now going around in Delhi where people are running from pillar to post and going from hospital to hospital and not finding a bed, even though the much publicized and much touted app seems to suggest that the beds are available. So there has been a mismatch, and there has been a little bit of politics that has kind of derailed the fight against corona in Delhi. Tanvi.
Yes, and in fact, I wanted to talk about the healthcare infrastructure part in these cities a bit more, and we will come to that, because fact of the matter is these are the cities with 60-70% of the caseload of our country, but they don't have the 60-70% of the health infrastructure available in our country. They have far lesser, which means that there is a bigger challenge, which is what Vinay was referring. So we'll come to that. But let me just bring in Dr. Giridhar Babu, Professor and Head for Life Course Epidemiology at the Indian Institute of Public Health in Bengaluru. Dr. Babu, many of us are extremely intrigued by how Bengaluru has been an outlier in this. They have had far, fewer cases than any of the other big metros, and almost every other metro is struggling with the same kind of problem of high density, slum area. Becomes difficult to control it, to test it over there. The public health infrastructure becomes a problem. What has worked for Bengaluru?
I think what has worked in Bangalore is that from the beginning, Bangalore has implemented exactly whatever the Government of India guidelines had laid out. If it was sealed down, if it was locked down, it was perfectly implemented to the point in every place in Bangalore, number one. But even before that, what Bangalore did was something called retrospective contact tracing. So when the first case came to India at that time, Bangalore did one new thing where for the last 1 month, they found out all the international passengers and they tried to identify who among them have symptoms and then followed it up. In addition to this, Bangalore has the advice of expert groups which are meeting mostly 2 to 3 times in a week. So with all these inputs and by strict implementation, the key here, Tanvi, is that during the lockdown, we had the opportunity to do containment, which means you do active surveillance, find cases, so that you don't allow the infection to spread across many people. I think that was done very well in Bangalore. There is no different model, this is no difficult model, but we have done well only because we have followed the rules and regulations really well.
Yes, in fact, because Bangalore would also be one of those cities that did see a large number of people coming from abroad initially. A lot of business executives who travel a lot. There was quite a bit of movement, and so in the initial days there were cases. I think what Dr. Babu says, makes a lot of sense to the fact that if you don't do your contact tracing correctly in the initial days, and then don't implement your lockdown rules properly and allow violations to take place, then it becomes a problem. In fact, let me bring in Dr. Anand Bhan also in that. Dr. Anand Bhan, as we look at different cities and see how Delhi is struggling and in fact seems to be headed towards a worse situation. Mumbai is in a bad situation, but it does look like it may improve. Chennai is a case where every few days we see a spike, and situation going out of control. There is a lesson to be learned from Bengaluru, but can we do that now? Can we go back to implementing a stricter lockdown, because now we're seeing a larger number of cases?
Sure. So thank you for having me. Whether we should be implementing a lockdown, I think is something certainly which is an option on the table. I think the lockdowns are only used if they're effectively implemented and used properly. If you're going to just think that lockdown is going to be a solution in any way, it's not going to happen. So I mean, whether Bangalore, whether many other parts of the country, especially the northeast, down south Kerala, places like Bhilwara, etc., which use the lockdown measure in terms of implementing contact tracing very well, and then ensuring that you isolated those cases which were positive, then you are going to be using a lockdown measure properly. If you are going to just implement a lockdown and not do anything else, or not do other things well enough, then you're not going to be able to have any success with controlling the spread of infection. So I think the lessons which are to be learned are not just the lockdown, it is also what do you do within the lockdown period, right? So, and how do you effectively use your public health infrastructure, your staffing, your outreach activities, your community engagement, working with the healthcare infrastructure, ensuring that everyone is following guidelines, that you have clear data available, that actions are done based on that data, and that information is transparently made available to the public so that there is public trust. Now, if you do this concatenation of efforts, then I think it is still possible for any city to be able to try to address a crisis situation that they might be facing. In fact, there is no alternative. The alternative otherwise is status quo and waiting for actually, the number of cases to keep on rising and keeping on planning and saying that, well, we are now prepared for 75,000 bed requirement, then 150,000 bed requirement. Where will we ever stop unless we actually try to put in our preventive measures? So I think that, no time is late enough. And I think now, even with the situation worsening in a few of our mega cities, I think the municipal corporations, the state governments, and the central government all need to work in conjunction with each other, which, as previous panelists said, we have sometimes not seen. So that is really disturbing that, you have governments which are saying things which are not, which are not speaking, not seemingly speaking to each other or in variance with each other, and that does not augur well for an effective response. So hopefully we will start to see more cooperation and more clarity of response, both at the local level as well as the state and national level.
Yes, okay, I take what you're saying there. Let me bring up two more cities and speak about Mumbai and Pune a little bit, and let's bring up those charts for our viewers as well. We'll start with what's happening in Mumbai, and Mumbai is very interesting, viewers, because for the longest time the active rate was far higher than the recovery rate that we were looking at. Then suddenly the gap narrowed, and now it's just stable in that zone. Now, the fact that, the experts say that there is some amount of improvement and situation coming under control in Mumbai, yes, that's also reflective in the data analysis that was done by Niti Aayog, and we had brought you that data as well. And now that's what is, you can see even in this chart that at least in the month of June, there is some kind of grip that we are getting, at least on the number of cases in the city of Mumbai. Now, this is as far as Mumbai is concerned. Pune is actually doing a lot better. But Pune has had a bit of a spike, a series of spikes as far as the active cases are concerned. By the end of May, it actually looked like they were completely in control. And since that, the recovery rate has surpassed. And it stayed like that. It's only gone further up, and the active cases rate has only come further down. So the Pune now seems to have managed to see considerable improvement. What remains to be seen is if this can continue as we now begin to lift our restrictions. Remember, and I want to point this out, in Maharashtra, there are separate set of restrictions for rest of Maharashtra, and then another set of stricter restrictions when it comes to Mumbai and Pune and Thane region, places where we saw high number of cases. So that has worked as far as Pune is concerned. Mr. Santosh Andale joins us this evening with his insights as well. How are you seeing the way these two cities have handled, and the fact that Pune seems to have struck the right chord, did the right things, and now is emerging out of that big challenge that it was facing in the month of April and May?
Tanvi, we have to completely agree. Compared to Mumbai and Pune, we are working towards to the right approach, door-to-door screening. Compared to less, we don't have much more facility in Mumbai like Pune. Pune's number is already reduced, and we are battle for the number of cases earlier. So now Pune, what Pune did the well job. They are doing door-to-door screening, quarantine facility, institutional quarantine, screening facility, everything they do. But compared to Mumbai, the slums area density of population is very high. Today is a very good day for Mumbai, like Dharavi cases, if you see, is rapidly come down, and they do the well job. Like, we have to first of all thank to our doctor in Mumbai, because Mumbai is a financial city, a financial city of the country, and our doctors working day and night, struggling to give the patient treatment. The only issue, we are not getting enough human resources in Mumbai. We are still struggling to get back the skilled human resources. Like, we are calling people from outside the state. Like, we have a little lesser staff, like doctors, nurses. We don't have. In Pune, we have enough infrastructure, we can say, and enough human resources. So what we have to do, we have to increase the human resources in Mumbai compared to other states. Basically, what we have to do, number of patients are increasing in Mumbai because testing has been done, but the human resources, we are less. Tanvi.
Okay, so Mumbai and Pune, Vinay, if you want to also come in on this, because again, close to our hearts, this is where, this is what we track extremely closely. Mumbai does have a big challenge, and that stays, and the health infrastructure part also stays. But it does seem like that the strict clampdown that happens, especially in the city of Pune, has helped. Of course, in crowded clusters, just like Mumbai, that threat still remains even in Pune.
Absolutely. And look, let's not make any mistake about it. Mumbai started off fairly badly. There was enormous confusion. If you remember, the BMC itself was indulging in a series of flip-flops over the policy they should adopt. They used to come out with schemes. Some of the implementation, the quotient of the schemes had left a lot to be desired. I remember when the previous administration of BMC in the leadership level, they had started a scheme of using thermal testing, and they wanted to use oximeters, they wanted to use devices which could test temperature. When they started actually going into the field, they discovered that Mumbai's weather was actually changing, and that particular machine was just ineffective in a very open environment like Dharavi. They kept changing those policies. They lost the battle in Dharavi to a large extent, and there was enormous confusion. In fact, there was confusion to the level where the three different parties who were actually governing the state were sometimes not even in sync over what was being done. The health secretary would say something and the minister would give you another version of the same policy itself. Having said that, I think at some stage they took the criticism that started coming their way positively and they changed. And what changed was, one, of course, the leadership of BMC changed. That was a bold decision to do because remember, it's not an easy decision for a government to take when you change the general in the middle of a war, which is what it was, because BMC is leading that operation in Bombay in terms of implementing the policies, and to change the general in the middle of a war was not an easy decision. It was taken. And that seems to have yielded some result because the new administration has certainly been a little more consistent with their policy and the implementation of that has improved. Pune, I think, in that sense is another good example because they started off badly but have recovered well enough to the level that now they seem to be on the path of being very, very comfortable if this trend holds. The other thing is, I think Bombay, I agree with Santosh when he says that there is a bit of a manpower issue. There is a struggle in terms of getting the paramedic staff, for instance, so the doctors are under enormous pressure and all the load is coming onto them. The Mumbai police came under a lot of pressure because of the large number of migrant movements that they had to handle. And remember, it was, I think, unfair for the administration to actually pile up all that pressure only on the police, including administrative work as well. That was a bit of a policy problem that we saw. But now that all of that is behind us, things seem to be recovering, and that's good news, Tanvi.
Okay, one city that we've often spoken about, and I want to bring it up again, is the city of Chennai. And just look at how city of Chennai is really performing as well. In fact, earlier in our first round, when we spoke about states, we also spoke about the fact that some of these southern cities and states are actually beginning to see a bigger challenge now than they did earlier. Now, Bengaluru is an outlier in that case, so we are not going to talk about that. But as far as Chennai is concerned, you've actually seen multiple ups and downs when it comes to active cases and recovery. So, around end of May, it did look like, as far as Chennai is concerned, that the recoveries had surpassed the active cases. And you can see that where the two lines are crossing each other. And for a while, the recovery rate was higher than the active rate. But then that's now again changed in the month of June. So what's happening here? Let's try and understand from Dr. Swaminathan. Dr. Swaminathan, would you say that a lot of this is also reflective of when we go into the next phase of lockdown, when some more things open up, then we see a spike in cases, and perhaps that's what's happening to Chennai?
That may be part of it. Another part of it is also that the testing strategy has also changed. There's been more focus on only testing symptomatics. So we're probably not testing as many mildly symptomatics or asymptomatics that could also be contributing to the unusual numbers. So I think it's multifactorial. But yes, I think post-lockdown, there has been a sharp loss of control in certain areas, because of which we are seeing a very sharp upswing in the numbers as compared to, say, Bengaluru. We were possibly comparable at the time of the lockdown, but we have since surpassed them, mainly because I think there's been a loss of control, and there have also been focal pockets which have taken off, some of which were completely unfortunate due to various reasons. And that those clusters have really driven the numbers. And even now, when you look at it geographically, there are certain areas in Chennai which contribute to the bulk of the load of cases. So when you look at it that way, you realize that it's the hotspots and those clusters which are really driving the numbers, but it's slowly starting to move into the rest of Chennai and becoming a more generalized problem.
Okay, but so you say that one of the factors also is the testing policy. In fact, earlier we had seen that Chennai wasn't even testing enough in the month of April, and then they ramped it up, which is where we saw a jump in cases as well. But as far as, if we compare it to Bengaluru, Dr. Swaminathan, in Bengaluru, they had strict implementation right from day one. They did a lot of contact tracing and got a grip on it right in the beginning. That perhaps can't happen for some of our other cities now. So then what's the solution to bring down the number of cases? Dr. Swaminathan, the question to you.
Sure. All right. So I think it's a little more complicated than that, because to me, as far as I can see, your first point that we moved in the containment strategy is absolutely key. we need to start playing it a little more sensible now. We can't be focusing on a preventive aspect because that horse is long bolted. We need to have containment strategies where we have different strategies for different areas. And we also need to see how we can use the testing sensibly along with case management, because I think the concern is also that the mortality is rising, and that's possibly because we are focusing so much on the testing that we don't have enough protocols on case management at home, and there is a huge pressure for people pushing into hospitals, and that's overcrowding the hospitals with low risk people, and the high risk people often don't have a place to go. I think we need to have a strategy on that, which I think the government needs to address that straight away.
Okay, I take what you're saying. In fact, we've largely covered most of the big cities that I wanted to introduce. We're going to keep running those charts for you. Ahmedabad, viewers, is a city just like Jaipur that has seen a significant turnaround in April, towards end of April. They had a high number of active cases. The active rate was much higher than the recovery rate, but a turnaround happened around end of May. And now the recovery rate and the active rate are kind of just, stabilizing in that level, and that gap really continues. That's actually very similar to the graph that we saw even of Gujarat. So it looks like exactly the way Ahmedabad is behaving, so is the rest of Gujarat, or perhaps this is the city that brings in the majority of cases as well. Now let's move to the second aspect, and the second aspect is, how will these cities tackle the cases? And Mr. Javed Ansari, let's talk about the problematic cities, whether it's Mumbai still, because of the large number of cases that we're reporting still every day, and Delhi, which is now beginning to see that kind of, 800, 900,000 cases every day. They have failed to build up their health infrastructure. Now, will that become challenge number one? And until we do that, should we again go into the lockdown? What are the authorities now thinking of doing?
Look, the authorities are none the wiser. They are groping in the dark, and so is the public. You can't, at the time of war, you can't build up infrastructure. So the infrastructure is virtually non-existent. It's abysmal. They ought to learn from Kerala. They ought to learn from the other cities, from Ahmedabad, from cities that have turned it around. Do things on a war footing. I'm told that the worst is yet to come, the worst is ahead of us, that this will continue to spike and peak either by the end of June or in the first half of July, and it's only towards the end of July that we will see some kind of, downward trend. Well, till then, you just survive in hope and in prayer, on a hope and a prayer, because there is very little. There are not enough beds. There's virtually no testing happening. 2,000 testing 2,000 people for a population of over 1 million amounts to absolutely nothing. They need to ensure that there are more beds, build quarantine centers. There are vast sporting stadiums here which are lying vacant. Use those. Use hospital. There's a mammoth hospital here, the All India Medical Institute. Why can't that just be converted into a COVID hospital? Let people be quarantined there. Let people be quarantined in these 5-star hotels which have been shut. And for God's sake, please shut down places of worship. We can all pray from our homes. I'm a believer. I pray 5 times a day. I'm very happy doing it from my home. Don't open all these places up. Don't open malls. These are things. This is not essential. We can do without these things. So as a resident of Delhi, I shudder to think what lies ahead of us. Tomorrow, if God forbid, I contract this, I won't know where to go. Even somebody like me who's a journalist, and I know few people in this town, I won't know where to go. There are, unless, we've just been left. It's all Bhagwan Bharose. I'm sorry to sound alarmist. I'm not one amongst those, but the situation is such that, you ask anybody, you hold a poll in Delhi, and 99% people will say that we've all been left to the mercy of the gods.
Yes, absolutely, and it's not being sounding alarmist, Mr. Javed. Sorry, because what you're saying are simply the facts. The government itself sounded as alarmist as it could be yesterday when they came out and said, "Well, we are anticipating 2.5 lakh cases by July, and end of July it could be 5.5 lakh cases, which means we need 80,000 beds. Let's get the stadiums going now. Let's get the hotels going." Suddenly, this conversation that is now happening in Delhi. The same government, Vinay, 15 days ago was telling us their health infrastructure is ready. Arvind Kejriwal in the beginning of May was the first one to come out and say we cannot be in lockdown forever. Our health infrastructure is ready. The cases will go up when you lift the lockdown, but we are prepared. Let's go. Let's open our shops. Let's restart our economy. Now it seems like as if the health infrastructure is not ready.
Yes, and I think now that we've seen about 3 months of this war against corona, there is one very clear pattern. There are chief ministers and there are people who govern our states who have believed that lockdown was the solution. There are some who were probably smarter who realized that lockdown was an enabler. That's not the solution. And I think if you just think that lockdown is the solution, then this is what happens, because that's not what the lockdown was meant for. The lockdown was meant for you to enable you to prepare for an eventuality where the cases will rise. And in Delhi, I sense that there is a bit of a smugness that they had, that our infrastructure is the best and we are the greatest and we have the best facilities in the country and hence we'll be able to handle it. I think this was a little bit of an ignorance about understanding how this virus works. There was a little bit of an ignorance about understanding the nature of the city of Delhi and the requirement that would have exponentially grown. It doesn't help if you stand on 10th June and say that contact tracing is impossible. Of course it is impossible, because now the number of infected cases, the likely number of infected cases is just way too high. That's where I like the idea of that Bengaluru pursuit, because that's the example of how they used the lockdown not to think that this was a solution, but used as an enabler and went very hard at contact tracing right at the start when the numbers are fewer and ensured that the spread did not happen. And that's where Delhi seems to have lost the battle. And now we will only play catch up. I mean, this is not something that they could have prevented it, because Delhi does have superior health infrastructure compared to other cities. Javed is absolutely right. You have AIIMS, you have Sadarjung, you have very large hospitals and stadiums and various other places which could have been contained, converted into containment zones or isolation wards. Nothing of that has happened till now. It's only now that they're beginning. Tanvi.
In fact, just very quickly on that, back to Mr. Javed Ansari. Mr. Ansari, I know what you're saying is absolutely right, but do you fear that that won't happen because of also politics? Because when it comes to the national capital, everything boils down to the center versus state. And the center in this case obviously hasn't decided to open up AIIMS hospital for more COVID patients. It's such a huge hospital, but I believe only about 250 to 300 of those beds are actually dedicated for COVID patients, and likewise in many other hospitals. It's something that the center should be immediately looking at.
COVID, Tanvi, if either Mr. Kejriwal or those who govern at the center believe that the fault will lie only with their opponents and not with them, they are mistaken. This will sting them in a manner they cannot fathom. Everybody's sitting pretty at the moment, but you talk to people on the streets, and you sense their sense of fear, their anger, and their total helplessness, and this is going to manifest. I do believe that at some stage, because Delhi happens to be the capital of India, and therefore they can't allow it to run aground, the center and the state will get their act together. But when will they do that, and how much of a toll by then will COVID have extracted in terms of lives of the people in Delhi is anybody's guess. But the fact is that at the moment, they haven't even begun it, and they ought to have done it day before yesterday. The signs were there. This was a pandemic foretold. This was a disaster foretold. Yet they were both sniping, trying to score political points. When I was absolutely right. In the beginning, they were both trying to score political points. Mr. Kejriwal assured us that he's made arrangements for 4 times number of than what is required. And what you realize now is that that not even half of that is true. The center is sitting pretty, very happy that allowing Mr. Kejriwal to stew in his own juice. But the fact is that if this spills over and if this blows up, it would spare no one. Even the center, even those sitting pretty at the center will have to take a lot of the blame.
Yes, absolutely, and it can't be just one party's responsibility. Unfortunately, right now it's just become a blame game. But let me go across to our other panelists as well, and Mr. Santosh Andale, because we are talking about health infrastructure in these crucial cities. Delhi is facing a massive problem right now. They're looking at stadiums, they're looking at hotels. Some of the hotels don't want to be converted into quarantine centers or treatment centers. There are legal battles that are now beginning. Mumbai has a similar problem. That we are right now looking for scouting for locations for isolation centers. That people don't come to the hospital, they should stay at home. There is a big battle right now going on between townships and societies who don't want to use their their own setup for people who are living there, and saying no, we don't want that kind of a risk internally in our societies.
Yeah, actually, tell me what happened in Mumbai. There are most of the places like Mumbai is the first city in the country. Must be we in the field hospital like Jumbo Facility Center we set up in Mumbai like Worli in Dome, where we set up a ICU. First time in ICU set up in that area. We have isolation center across the city, but most of the isolation center right now is empty because of there are some basic hygiene infrastructure issue in the isolation centers. Many of the people wanted to bed in the hospital. They don't want to go to the isolation center directly. Everybody run pillar to post in the Mumbai to get the hospital. But most of the people not getting bed in the hospital. This is the current situation in Mumbai. Across Mumbai, we have more than 5,000 bed with the oxygen point, along with the oxygen point. But the issue is, every people wanted to go to the hospital. A symptomatic patient, most of the bed is occupied in the hospital. Many of the people who are asymptomatic, they also wanted to go to the hospital, but they are not getting a bed. So major struggle in Mumbai is the health infrastructure. Public health infrastructure should be beef up. It's a wake up call to all of us. We should beef up scale up the health infrastructure, and everything should be fair to the poor people, because most of the poor people not getting bed properly in the city. They have to wait at least 8 to 10 hours. And now the isolation center should be more human resources, the nursing, doctor, paramedics they need. Tanvi.
Right, absolutely. In fact, viewers, the biggest challenge for Delhi and Mumbai, the two of our biggest cities with the largest number of cases, and more so for Delhi right now because the cases are still going up, is not just beds. It will also be ICU facilities, it will also be ventilators, it will also be support staff. You need doctors and nurses and attendants who are going to be present. And if you see, horrifying stories are emerging from hospitals in Mumbai and Delhi. For that very reason, you don't have this support staff. Mumbai at one point said, okay, let's see if we can get more support staff and medical staff from other states, because we need that. These medical fraternity people have been working round the clock for 3 straight months now, and they will have to do so for several more months. So there has to be some amount of relief that also comes for them. In fact, Dr. Babu, let me bring you on that aspect. How are cities preparing for the longer haul, for the fact that this isn't going away? So we will need people and beds and facilities for several months now to deal with COVID.
Yeah, I think, Tanvi, what we are missing here is most of the cases, even in Delhi, Mumbai and Chennai, are contributed by clusters, and we have almost forgotten the role of clusters here. Now, I'll give you an example in Chennai. Nearly more than 2,500 cases are linked to the Coimbatore market. The same thing in Dharavi slum, same thing in the Nizamuddin, same thing with the Nanded pilgrimage. So the story is very clear all over the world. Clusters are the ones which have to be prevented. Japan, even without lockdown, could do so well by following prevention of clusters, prevention of crowded places, ensuring that in the close contact settings, there are no close range conversations or anything of that sort. By following these principles, even now in the metros, we should be able to prevent the spread of the cases, number one. Number two, to your question, we need to be not be in complete despair, but then practically and very pragmatically plan. In order to do that, it's not the ventilators that we require in terms of intensive care units. It is the oxygen supply. So again, one more good practice in Karnataka is when they realize that this is going to be the problem, all the general hospital beds are fitted with oxygen cannulas so that when they require, high flow oxygen can be given. Now they are developing a plan in terms of which hospital will be used first and then which will be next. They've already taken partnership with the private in terms of how they'll manage the workload. Even now, let's not be in despair. Let's not feel that the game is over for some of our cities. That's not true. Let's plan and then make sure that these 3 C's are followed. Prevent cluster formations, ensure that there is close contact settings are reduced, and in all the closed spaces, make sure that we are managing physical distancing and masks. Now, these are the 3 C's. Then let's pragmatically plan in terms of how to really, on a real time, distribute the beds and the ICUs. We need to get our acts together. It's not just the government's responsibility. We all need to work together in terms of finding solutions, even in the places where higher burden is there currently, Tanvi.
Okay, fair point that you've made. In fact, let me bring in Dr. Swaminathan on this as well. Dr. Swaminathan, what should be the way forward for some of these cities in terms of ensuring that the healthcare infrastructure is there? Honestly, it should have been there by now already, but there are cities like Mumbai and Delhi which are struggling badly.
So at least some states have made some changes on that. In Tamil Nadu, they've already identified some areas where they have quarantine facilities available, whether it's an IIT Chennai or other places. I think, like was mentioned, we need to have setups which can have quasi-medical facilities and a triaging-based patient movement into the medical facilities, because we can't afford to have everybody coming into a healthcare system and crowding our hospitals so that it becomes completely unavailable to the patients who desperately need medical care. And unfortunately, that is exactly what is happening right now. So, I mean, it's easy to say what I'm saying right now, but it's a very practically difficult approach. And one approach that a lot of centers are doing is taking control of the hospital so that they control the narrative of who gets into the hospital and what kind of care is given and things like that. Not a very easy thing to do, because obviously there are other issues which could be, which could be a problem here. But short of doing this, I really don't see how the government can really control the narrative.
Well, I want to reiterate the point that Mr. Javed Ansari was making earlier, that in some cities the situation is now still so serious that people don't know what to do and where to go. And this entire system of allocating hospitals and allocating beds and testing and then telling you which center, quarantine center, level 1 hospital, level 2 hospital should you go for, it's just become so complicated that it's turning out to be a nightmare for quite a few people. And Dr. Bhan, while that's one aspect of it, the other aspect is availability of healthcare workers. Now, if we are going to say that the number of cases are still going to go up and we haven't peaked yet in many parts, where are we going to find these many healthcare workers? Dr. Bhan, the question is to you that, one big challenge which will also be as we build the healthcare infrastructure, where do we get the additional healthcare professionals from?
Yeah, that's always going to be a challenge. I think, the advantage, for example, in China was that there was a localized spread of infection in Wuhan, and so they could get healthcare professionals from other parts of the country. So listen, I think, it's going to be a bit of an agenda of redistribution, which might mean at the state level and across states, we might need to do some redistribution of health professionals. It's also, I think, a time to talk about retraining, because a lot of the frontline work can actually be done by healthcare providers who don't need to be specialists always. But, this is something we've been talking about since March, February, even earlier actually, and saying that you need to prepare for that eventuality and start training people so that they know basics of how to do intensive care, basics of how to manage patients, etc., and how to do triads, etc. But I think many governments failed at that. But even now, I think it might not be too late. If we can retrain, if we can keep doing intensive training and ensure that we can deploy staff in such a way that they are able to address the basic
Right.
care requirements, and then specialists are available when there is a requirement for, because everyone will not require specialist care. So I think it's just a matter of being very smart about redistributing your existing healthcare staff, ensuring that you minimize burnout, because that is another worry that I have as this infection spread continues and a lot of our healthcare staff get stretched to their limits. There will be burnout. There will be many of them who will get infected and they will fall off the workforce. And then what do? We will have an even more ill-prepared health system there with the lack of
Yes.
human resources. So I think the time is now to start planning and retraining some of our other staff members who can step in, who can be the reserve, and as and when they are required, they can be deployed.
Yes, in fact, that's a problem, in especially in cities like Mumbai, also with our police forces. So it's our civic body officials who are out there on the field, organizing and testing and screening. They are the ones who are also getting infected. Also your police officials, and then your own healthcare workers. Three departments where the authorities will have to give specific attention in these cities to ensure we are able to battle this out in the long run, because the coronavirus is not going away. I'm completely out of time, so I'm going to thank all of our panelists for joining us. Very quickly, viewers, let's one more time go through what the key takeaways were from the numbers and the data graphs that we put out. Now again, these are not projections. This is the data available, given to us by the government. We've just simply made some calculations and drawn these charts for you to understand where your city stands and how it has been faring. Ahmedabad has seen a rapid rise in the recovery rate and is actually now doing much better than what it was last month. Delhi, on the other hand, is the other way. There's a rapid rise in daily cases since the 1st of June. And the anticipation as per the government itself is that it's going to worsen from here on. Mumbai, the recovery rate and active case rate gap is narrowing. So that's slightly better news than what Mumbai had also seen last month. We seem to be having our better days right now. Bengaluru, an outlier in terms of low number of cases through this entire pandemic. Gradual fall in those active cases as well, and the recoveries are rising steadily. Chennai, the fall in recoveries and rise in active cases is what is visible right now. Kolkata, recovery rate and active rate are flat. Jaipur, just like Ahmedabad, has been a city that's actually done significantly better. It has recorded a steady fall in its active cases, and Pune is now showing signs of improvement with active cases starting to fall. So that's as far as the information as of 10th June's report is concerned. We're going to keep a close track, keep getting you these updates. The challenge of healthcare infrastructure still remains in all of those cities, and that continues to be the big focus here. Thank you so much for joining us. Welcome back. Let's get you the latest from Assam, from Tinsukia district of Assam, where there is a massive fire that is raging on. In fact, 2 people have died in this fire. The 2 bodies that were recovered are suspected to belong to the firefighters who went missing yesterday. The blaze can now be seen for a distance of 30 kilometers. Viewers, this is a fire that broke out in a gas well that was under the Oil India company, and Oil India officials are now saying it will take at least 4 weeks to put off the fire. 16,000 families have been evacuated, have been shifted as the fire continues to spread to areas in that zone, to villages in that zone. Let's go across to Arindam to get you more. Arindam, take us through what is the latest as far as the firefighting operation is concerned.
No, still rages on. It has been contained, but the fire in the oil still continues to below, and it can be seen from several kilometers away. And experts from the Oil India Limited, the ONGC, the State Disaster Response Force are trying to contain. It is right now uncontrollable, and as well as from Assam government, it has been made clear that it will take another 1 month's time to contain the flames. So let me bring into perspective as to how this fire has broken out. Gas well in Bagjani was leaking gas from the past 2 weeks, from 26th of May. And day before yesterday, a 3-member team who were here on invitation because the fire was uncontrollable by the Oil India Limited, and 3-member team from LR Disaster Response arrived at the scene.
All right, we have a bit of a patchy network there with you, Arindam, but thanks so much for joining us. 2 people have been suspended, 2 officials, for negligence. The gas had been leaking, like Arindam was saying, for the last 2 weeks, and then it broke into a fire, which will now take at least a month, officials are saying, to be put off. So clearly a big challenge there and a massive problem that continues in the state of Assam. Well, we're completely out of time on this edition of the Urban Debate. Thank you so much for joining us.